Welcome everybody. We'll give a few minutes to let the rest of the crowd kind of make its way into the webinar. But welcome and great to see everyone again. I guess, do you mind with the lead monitor here having it on, kind of showing myself? Perfect. How are we looking, fellas? Good. All right. Well, without further ado, let's get rolling. We'll jump into our 8th webinar, which is man, does time fly when you're having fun? It's been great so far. Welcome. Today's topic, as everyone knows, tuning in, is how to improve range of motion with your clients through the use of kinesiology tape. This is a big, broad topic. We're going to break it down into certain patient populations because, to be honest, how you tape for different patient populations to achieve range of motion requires some different approaches. So we'll try to categorize that for everyone, and hopefully we learn something. We wrap our head around how the tape helps the rest of the treatment that you're doing, and should be a fun topic. As always, at Spiretech, our mission stays the same, to elevate your client's recovery, arming you with the streamlined kinesiology tape solutions. What that means is we provide the best possible product kinesiology tape wise, so you can in turn provide that same high quality treatment for your clients, and then that hopefully turns into a greater experience for them, greater outcomes, and more patients seeing you on a daily basis. My bio, the important thing I think, or where it becomes relevant for myself, is I've spent the last 16 years or so working in golf and tennis at the highest level. And so rotation becomes a huge piece of what I do day in and day out, whether I'm in the clinic or on the court, on the golf course. And that goes from anywhere from the young kids and working on athletic development, making sure that they have the rotational basis to kind of continue improving, all the way up to the professional level where you're making sure that they not only can create the proper rotation, but they can also control the rotation that they have, so we can get ahead of it and prevent injuries from happening. So we'll kind of touch on both those topics, but rotation is a hugely important piece, both from the creation and the control of rotation, to make sure that you can make a good living at your sport, but also that you can stay on the field and don't get injured. With our webinar goals for today, we're going to focus on how Spiretech can improve your client's range of motion. And then we're also going to look at how we would tape for range of motion improvements, and we'll take a look at the ankle pro-cut when we do that. The first research paper that we'll dive into is going to look at dorsiflexion, and so this is the application, the pro-cut that I would use with most people to help with improving their dorsiflexion to improve their range of motion. And then, as always, we'll jump into a Q&A at the end. So if you have any questions, type them into the chat. You can type them in as we go. You can wait till we're done, but make sure, you get those questions taken care of. We've had a lot of really good questions that help people with some clinical pieces, answer some questions they have, tying what I say to their own patients to be honest, after every webinar so far. With our SpiderTech pieces, we know that because we do a great job of providing you the highest quality product, we have tape for every part of the body. We end up getting a product that is standardized. It is simplified. It's long lasting because it is machine cut. It is the highest quality adhesive and cotton that you can get. It becomes reproducible because you know exactly how to place it on every single time, which saves you time and also enables you to put it on in the office or on the field, on the court, anywhere you happen to be, you can apply with the highest possible efficiency. So we broke it down into some different patient populations for today. The first one we're going to look at is going to be your healthy person, the person who really doesn't come in with a problem, other than the fact that you've recognized that their range of motion is not what it could and should be. And so this is one of the ones I think you can recognize in practice where it's, okay, like this is not necessarily the pain here, but this is a range of motion issue that I recognize, and I want to be able to correct that. So that's where we'll dive in first. After that, we'll look at how to help with range of motion decrease after delayed onset muscle soreness sets in. So after DOM sets in and your clients start to feel pretty sore and tender, we can use tape to restore that range of motion. We'll look at how we can restore range of motion after surgery, after an injury. And then lastly, we'll look at kind of in the middle of that where you have an arthritic patient and you want to know how can I get them back, how can I restore some of their range of motion, both from a joint standpoint, but also from a muscular standpoint and a getting rid of the fluid that might be in the area standpoint. So the arthritic chronic clients or patients kind of ties it all together, I believe, where we want to achieve range of motion that can come from a bunch of different places that can be coming from your arthritic patient. So diving in, as I mentioned, the first category, this first silo we'll look at is how to help your patients that you recognize a range of motion deficit, even though they don't complain of that, or that's not necessarily where the injury is. So this first article, it is looking at how can kinesiology tape help duathletes, which is a triathlon minus the swimming, so it is biking and running. And so we're looking at what they did here is they taped each one of the athletes. They checked the dorsiflexion of the athlete. They taped the athlete. They rechecked the dorsiflexion. They ran the duathlon, and then they rechecked everything again. And so we found some very interesting things from this piece. So as you can see with the next slide here, that this is the manner that they checked the dorsiflexion of the ankle. I would generally use a knee-to-wall test in clinic, but here they're obviously using a dynamometer and they're checking it in degrees versus checking in like a centimeter or inch type of manner. This is something that I do in all the in-person courses that I do. This is one that when I first started doing this in person, I was taking a little bit of a leap of faith that it would actually see the results that I wanted to. But as a result, I was proven to be very wise, because every single time I've looked good, because we see some significant improvements in dorsiflexion like kind of checking, taping, and then checking again, and we see some pretty impressive results with some people in terms of dorsiflexion. So in this case, what they found was before the race even began, just check or measure, tape, measure. They saw a greater than 1 centimeter on average improvement in their dorsiflexion, which, because they measured in degrees, it ended up with just under 3 degrees difference, which is just above 1 centimeter of difference. And this did achieve statistical significance. They looked at the pain pre and post, the same way they looked at dorsiflexion. And although we saw a 38% improvement, which sounds significant, because the numbers were so small before the race started, this didn't achieve statistical significance, but we still saw a improvement of 38%. And then after the race was done, there was a 19% improvement in the amount of pain that was seen in the taped leg versus the other leg, or the non-taped leg. And of note, there also was no cramping that happened in the taped leg. There was a number of people that had cramps in the other calf that was not taped. And that's something that research-wise shows up over and over again, and there actually is a research paper that makes note of that, where to their knowledge, there's never been a cramping scenario in a group that uses tape, so of interest. So if you're dealing with cramps because of whatever reason, then getting tape on there is shown to be a very successful way to address that. And what they concluded was, in conclusion, applying the kinesiology tape on the calf seems to significantly increase ankle dorsiflexion, as we were looking for, immediately but not after the duathlon competition. Placing the kinesiology tape on the calf does not seem to reduce muscle pain immediately after the application. However, it appears to control the increase in pain of the triceps surae after the duathlon competition. Therefore, athletic trainers and physical therapists may apply the kinesiology tape to athletes before competition in order to control soreness or cramping in the muscle. And the only thing I'll highlight with that was, even though the pain level the range of motion level did go down after the competition, it still was significantly better than the control group after the competition as well. So that kind of covers if you see someone in clinic, you notice that they have a dorsiflexion issue. I'm going to get some tape on the foot. We'll go through at the very end how I would tape for that using our ankle ProCut. But yeah, that's something that I will do day in and day out, multiple times, to be honest. Anytime I recognize a dorsiflexion range of motion issue, and certainly one that isn't a joint based. But even if it is, most times you'll end up with a joint and tissue restriction as well. All right, so moving on to our next piece. This falls in the same category as well. I did want to include this one. It was a question that came up in our most recent in-person training course. And so, Dr. Shepard, if you're watching, this is one that looks at straight leg raise and the benefit of using tape on the hamstring. The question was asked during the in-person, and I said that in practice I would use it. I suspect we see good results. I felt I was getting good results, but I didn't know of any specific research that looked at it. And so as a result, I went and dove into the literature, and we found some evidence to support what I was claiming. So here we go. This is looking at a straight leg raise with using kinesiology tape to hopefully improve that range of motion of the straight leg raise. And so as I mentioned, we looked at the hamstring, and the straight leg raise was the objective measure. In the next slide, we'll see that this is the taping that they used for the hamstring. Pretty straightforward, covers the entire hamstring, wraps around around the knee, kind of getting into where it intertwines with the calf. And our results. In the next slide, we see that the way that they measured it was they asked the person to go into an active straight leg raise with the knee extended. So it was just a hip flexion motion. So the hip was flexed all the way up, and then once they got to the end of it, the examiner would help them get any further that they could get, adding a passive piece to the range of motion, and then they would hold that, and then they would measure the hip flexion angle at that level. So something that would commonly we be seeing in practice in our clinic. Anyone who has a hamstring flexibility issue that we think is putting pressure on the low back, that is affecting the hips, that's affecting the knee, affecting the dorsiflexion of the ankle. All these things, if you notice those hamstrings being tight and you think it has a wide-spreading downstream effect, or if you think it is just causing some hamstring aches and pains, then that's where I would use this application on the hamstring on a regular basis. So as we dive into the numbers here, we're focusing just on the hamstring, although the quadriceps they did test and they saw some statistical significance there as well, but we're going to focus just on the hamstrings today. What we saw that was that on both the right and the left side, the average person in this study had about 80 degrees of flexion available at their hip, and then immediately after the tape was applied, we saw between a 7 and an 8 degree improvement in the amount of hip flexion, which is pretty impressive that you can get almost 10% improvement in the amount of hip flexion immediately just by adding our tape to the hamstring. And then after 3 days, they retested, and we saw that that 7-degree improvement jumped to 14 and 19-degree improvement in the amount of hip flexion that was available. So again, proving my initial thought that the answer to Dr. Shepard's question, which was would tape on the hamstring affect the straight leg raise the same way the tape on the calf and the bottom of the foot would affect the ankle and dorsiflexion. So I think this proves the answer to that one is yes, and also a really common issue to see in practice and something a lot of your patients hopefully can benefit from. And then the conclusion, our study has revealed that the sustainability of the tape significantly influences muscular elasticity for the hamstring and quadricep muscle group. It has also shown a positive impact on power output. The research suggests that utilizing kinesiology tape for long-term use can be beneficial for athletic events that require increased hip and knee flexibility. And then you can read the remainder of that, but that certainly answers our question. What we set up to find is, can we increase our hip flexion with kinesiology tape? All right, so that concludes our athletic, non-injured population of patient, and I think again something to keep in mind. And I would expect those benefits to extrapolate to really any part of the body that you think a tissue tension is restricting range of motion. And we'll kind of get at the very end. We'll dive into tone versus stiffness of the tissue. But when there is a stiffness, which is more like a neurological issue, I think that's where we see these big improvements versus stiffness, which is more of a feeling of tightness, a feeling of pain. We do see improvements, which we'll look at the very end. But I think that tone is where we see the big changes immediately in the tissue. All right, so we now dive into our athletic population after a hard workout. So we're now looking at a study that looked at the longer application of kinesio taping that would be beneficial for exercise-induced muscle damage. So looking at using tape after a DOMS inducing workout. This also can be after any kind of workout that you would, maybe it's a little harder than usual, or if you went harder on the court or field than usual. And so the significant piece here is that although the study goes up to looking at 96 hours after the workout, the longest they kept the tape on for was 24 hours after the muscle damage inducing workout. So we probably could extrapolate that we get great results here, which you'll see, but if we kept the tape on for the 96 hours, I think we would also see even further benefits. But it does highlight just how important it is to get the tape on either before the workout, before the training session, or immediately after the session occurred. So the first graph we'll look at is just how we saw the range of motion benefits. And I think the thing to look at here is our KT 24 hours. This is the piece that had the tape on the longest. I think the benefit is that in between the after the workout, so the tape goes on, then they do the workout, and then afterwards they measure it. So in between the pre and the post is where our workout is. And what we see here is that the degree of range of motion loss is significantly less than every other tape application. And then also they bounce back faster, so we can get that slope of the line between post and 24 hours is greater, as well as we can get back the range of motion that we lost right after the workout. And again, up to 96 hours, we still see the range of motion being preserved, essentially. We're still at a little bit less than where the range of motion started before the workout, but compared to having no tape or taping the tape off earlier, we see significant improvements. And then we also will look at this graph too, which looks at the how we get our improvements with soreness as well. And again, the same idea is that after 96 hours, we can keep the level of pain lower than usual with all the other applications. And so then if we dive into just kind of looking at the numbers of the statistics, what we see here is if we look at the range of motion piece first, compared to having no tape on, that at the 96-hour end piece, we have a significant amount of more range of motion than with no tape. We have a 17-degree difference. Our pain is almost back to zero. Is kind of 1 out of 10 versus the no tape group is 4.5 out of 10, and then our strength recovery is almost back to 100% for where it was pre workout. And then the last piece is the kind of the fluid that's created as a result of the workout and muscle breakdown. In this study, they looked at creatine kinase as an objective measure of muscle breakdown as a result of the workout. And so what we saw and what we see here is that as a result of having the tape on for 24 hours after the workout, the fluid, the blood, doesn't pool in the area, and you get back to your pre-workout state a lot faster. So in this case, we saw that there is, in terms of looking at creatine kinase, there's 1,100 units of international units of creatine kinase, where if without tape we're looking at 8,000. So just under 8x more creatine kinase circulating in the blood if you didn't use tape. And so the mechanism for that, we're thinking, is that the tape goes on, it lifts up the skin, it elevates it, and it allows the fluid to move out of the area the same way it would on a normal basis if the workout wasn't there. Our thought is that because of the muscle damage, the things become puffy and swollen, and then it inhibits a little bit the ability for the fluid to move out of the area. We get pooling, which the tape allows to disperse out. And then the conclusion of the study as a result is that according to the results of our study, the kinesiology tape should be used in both situations, during exercise and after exercise, for up to 24 hours. That's as long as they studied. I would argue that they should use it even longer in order to promote faster recovery following eccentric exercise. Furthermore, kinesiology tape may be a useful technique for physiotherapists and athletic trainers in preventing muscle damage and promoting faster recovery from exercise-induced muscle damage. I use this all the time especially with tennis players and with golfers in training camps. When we know there's going to be DOMS that sinks in, we'll get tape on right after the workout, and the athletes I work with know that they'll wake up the next morning feeling so much better having put the tape on versus waking up without using tape throughout the night. We also work with a number of cyclists that in between stages of their races, while they sleep, they'll use tape in the areas, mostly the knees and the quads, but any area they feel sore in, the same way that I just mentioned with the tennis and golfers. They know they can wake up and be fresher tomorrow, and they know tomorrow their athletic ability and their ability to compete and perform at a high level will be increased as a result of not being as sore and dealing with the symptoms of DOMS. All right, so we now start our next silo, and so this is our looking at after an injury. So in this study, we look at kinesiology tape and manual lymphatic drainage soft tissue technique after a total knee replacement. So what we found in this study, and so as you can imagine, this becomes a lot more of reducing fluid, swelling, inflammation, opening up the lymphatic channels, making sure we can get the fluid that occurs as a result of the surgery out of the area so you can restore range of motion as fast as possible. So the first couple were let's kind of stimulate the nervous system so we can restore range of motion. This becomes a lot more about let's decrease the pooling, let's decrease the congestion so you can express your range of motion in the area. The tape that they used in this study, as you can see, it very much resembles our fan ProCut. They spent a lot of time taping this, where if they had to use the fan, it would have saved them a bunch of time, and the corners would have been a lot prettier, and it may have lasted a little longer. But it certainly resembles our fan ProCut for anyone who's used those in the past. And what we saw in terms of knee range of motion was, in this study, they looked at exercise and tape. And so when they just use exercise alone, that after the 3-day period, we had a 13% improvement in knee flexion compared to pre-op. And then in the exercise group, a 9%. And then with the knee extension, essentially identical results with the knee extension. But I think certainly in my experience, the knee flexion is one that is harder to get back just from a fluid standpoint than the extension. So I think in this case, the exercise, which was a good program, was enough to kind of restore the extension in the knee as well. And then what we saw here was a significant improvement as well in the pain that was felt, where but after the 3 days there was a 38% decrease in the pain, with exercise just a 22% decrease. But both worked very well. I would throw in that when you're using your manual therapy, that we could expect even greater results than this alone. I mean, we're always going to do our exercise to make sure that we restore the function of our knee. We can add in tape, and then we can add in the manual therapy techniques that we do. And I think all these results would expect to be even greater than what we see here. The other outcomes we'll take a peek at is because we're looking at, or our thought was, if we can decrease the fluid, we can increase the range of motion. Well, we can, around the knee, we saw that there was a 42% increase in the width of the thigh around, above the knee, where we were able to keep that down to only a 35% increase with our tape. And then kind of across the board, we see better limb circumference measurements than with exercise alone. And actually, compared to the pre-surgery, which obviously the person went in with a knee that wasn't in great shape because they needed surgery, but with using tape, we were able to actually decrease the circumference of the calf and the ankle fluid, as a result of getting rid of the fluid, compared to what we saw even before the surgery occurred. Where the exercise group, we still saw an increase in the circumference of the limb. So significant improvements there, even compared to pre-op limb circumference measurements. All right. And then our last silo that we're going to address, which is our arthritic patients. And although we see this in multiple areas of the body, the wrist is another one that you see very often, shows significant improvements. The knee, with knee osteoarthritis, we see a lot of research that kind of shows the benefit of using tape for that area of the body. And with this study, we look at the effects of kinesiotaping on pain, range of motion, and functional status in patients with osteoarthritis. And so we just dive into the numbers initially. This is a very short study. We looked at pre-tape, immediately after tape, and then a 1-day follow-up. And what we see here in terms of range of motion, we use flexion range of motion as our measurement. And, my mistake, is 72 hours, not 1 day. But so what we see here is with our baseline, we saw that knee flexion with our osteoarthritis patients was on average about 103 degrees. And then 1 hour after we use kinesiology tape, we see that there is an increase in about 15 degrees in the amount of knee flexion they saw. And then also after 72 hours, we see even further increase in the amount of knee flexion that we see. I will stress again that we can expect even greater results if you add in your manual therapy to this equation as well. But the thing that I do like about this study is that they used a sham taping group, and so it wasn't that the time was enough to increase the range of motion, and the testing was enough to increase the range of motion of the knee significantly, because we do see that the sham taping does kind of keep a consistent 110, 111 degrees of knee flexion, where we see that big spike with tape use in knee flexion range of motion. And if we look at the pain levels that are felt, this again is kind of a nice side effect benefit of using the tape, even if range of motion was our main objective measure. We see here that in both groups we started at about a 5.5 out of 10 VA, like visual analog scale measurement, and then 1 hour after we're taping, we see a drop to 4.1, and then 72 hours after taping, we see a drop to 2.6, or a 73% improvement in the amount of pain that we saw from just using tape. Again, I'll stress that I bet you can get that even better with adding in some manual therapy techniques. Again, our sham line stays pretty even here. We're getting the same numbers across the board, which is great to know that the amount of time in the testing didn't affect our numbers. It was tape based as the reason for our improvement. I think this also is where we can tie in everything we saw within the last silos, where we had our person who has no issues in terms of pain, we just want range of motion improvement, to we have someone who there's injury and there's pain, there's sensitivity, all the way to there's a bunch of fluid in the area and we want to clear the fluid out. So like the arthritis patient kind of spans that whole piece, and I think we can have an improvement or an effect on all of those individual pieces to see some improvement here. And I promise you that it won't happen with everyone, but you will get some arthritic patients, especially in the knee, who they put the tape on and they're like, what is happening here? There has to be some sort of medicated feeling to this because my knee feels so much better instantly. And I think that is where we get a little bit of motion, or a little bit of lift, so we get the fluid to move out. But I think that's where the tape on the skin affects the nervous system, and we get that muscle tone decrease, and so that quad or the tissues around the patella start to instantly kind of decrease in tone, and all of a sudden it feels like things just relax and your knee feels like it's way better than it was. I think again, you won't see that with every patient, but if you do use this on a regular basis, you will see it with a number of patients, and they will immediately feel a ton better. And then the conclusion of this study is that this study provides preliminary evidence for the use of kinesiology tape for improving pain and function in patients with osteoarthritis of the knee. It is recommended that clinicians and therapists introduce kinesiology tape as a practical method for decreasing level of pain and improving function. Future studies should examine the effectiveness of kinesiology tape over the long term and directly compare the treatment with other therapeutic options in patients with osteoarthritis. And this comes back perfectly with what I was saying is, they can compare those things, but like why? Like you're gonna use the other modalities that you have. You're gonna use all the other techniques that you are very successful with. If we add tape at the very end, which takes the place of nothing, your options for use of tape at the end of your treatment is either do use tape or don't use tape. Have your patient leave and the therapy ends when they leave your office. Granted, they could be doing some exercises so that they're going to be benefiting at home, but by taping your clients as the last move you do before they leave your office, the therapy continues the entire time that they're away. From seeing you 24 hours a day, 3, 4, up to a week, depending how long the tape lasts on their skin, even while they're doing the exercises, which you also could make the argument that by normalizing the muscle tone, by normalizing the amount of fluid that's in the area, their exercises become easier, they get stronger, they're less sensitive, and they progress faster even with the exercises as a result of having the kinesiology tape on the area of the body as well. So multiple benefits. And really your choice is do tape or don't tape, and this certainly takes the place of nothing else that you're currently doing. All right, so that is our last patient population study that we'll look at. The final piece, the final study that we will address is looking at how the tape affects muscle tone and muscle stiffness. And so difference between those two things is significant. We'll call the stiffness, the tone piece is going to be how the tissue, the level of contraction through the tissue as a result of the nervous system, the resistance to postural changes, how tense or how much activation the muscle is using as a result of the brain controlling that muscle. And then the stiffness factor will be how the tissue that you're talking about feels as a result of it, what's happening around it. So more of an objective measure about kind of the feeling, the pain. It can feel as if it's tight and stiff, and it does feel like it's tight and stiff. But we'll look at more like those two things in separation of one another, of tone versus stiffness. So what we see here, and we use the supraspinatus as an example. This is our muscle tone, and all we did here was add in. So if we go to the next slide there, good. All we did was add in here tape with our normal physical therapy modalities. So they use TENS, they use exercise, and they use heat as our normal PT protocol. We did that with tape as well, except we added tape. And so the reason why I think we get great improvements in tape is because this is a neurological based improvement. This is our muscle tone. This is where the tape is on there all day, every day, and it gets the brain to relax the area, normalize the tissue to where we would want it to be. So we decrease that tone significantly. Really, certainly after a week, we get big numbers compared to just physical therapy alone. And then we see with our stiffness, which is going to come down to, again, more of our pain, the feeling of how the tissue feels. And this is where we see improvements compared to just physical therapy alone, but improvements aren't as great as the actual tissue tension itself when we start kind of evaluating the neurological piece. So benefits across the board in terms of how it feels versus how it tests. But I think this highlights why we see improvements in range of motion even when we don't have pain. Why we see improvements in arthritic patients who have a really tight quad as a result of the knee not having the normal function, and we see these like instant crazy improvements, but they wouldn't have said the quad was sore, or they wouldn't have said it was really, really sore, but it wasn't until the tape was on there and it normalized that they thought, oh my goodness, this is so much better. And then the conclusion to this study of patients with supraspinatus tendinitis is that this study underlines that physical therapy is more effective in improving muscle performance when it is combined with taping, and that the combined approach can be used as an important intervention strategy for patients with shoulder pain. And I think that sums up everything perfectly. We do want to use all the interventions you currently use and have success with. We want to add tape at the end for the finishing move and to further improve the benefit instantly, but also in between the treatments that you provide. We'll take a look now at, as I mentioned before, at the application process for our dorsiflexion piece, but our ankle pro-cut. And as we play the video here, we'll kind of walk through how I'm thinking about taping. When I'm thinking dorsiflexion of the ankle as the objective measure that I want to improve, what I'm checking really is I'm going to look at all the tissues that would have an effect on the ankle itself. So I'm going to look at the bottom of the foot, the plantar fascia, and all the muscles and tissues through the plantar side of the foot. I'm going to look through the Achilles and up into the calf, certainly. That commonly would be a place where we'll see tension that is putting stress through the Achilles and affecting the dorsiflexion the opposite direction. But I'm also going to look at the front of the foot up into the top of the foot there through our dorsal side, because commonly we'll see that tibialis anterior tendon, if I find that tendon, that muscle isn't relaxing, and even if position and trying to get it to be in a position where it should be relaxed doesn't occur, I'll get tape on the front of the foot, which I find really helps to normalize the function of the tibialis anterior, and in turn it will make sure that the front of the ankle has a little more breathability. But the bottom of the foot is a no-brainer, being with this connection through the plantar fascia, through the calcaneus and the Achilles tendon. So I'm always going to make sure we get some tape on the bottom of the foot. I'm going to cover that Achilles up into the calf muscle. And the key when you're taping your clients is just make sure you get tape over top of the area that's tight. I mean, use your touch, use your excellent decision making to kind of feel where the tension is and get tape over top of that area. And then the last thing I'll mention again, as we come through the front of the ankle, I believe that when we see that tibialis anterior, the front of the ankle being tight, I think that causes compression through the ankle. It causes the joint to not function properly, and by getting the tape over top of that area, we can kind of normalize that. It can relax, and all of a sudden we have a ton more ankle joint motion just because the compression as a result of the muscle contracting from above and below the joint is normalizes into a position that we can express our ankle function properly. And so for when dorsiflexion is our objective measure, this is a great piece to help that. And then also in terms of other diagnoses as well, if you're looking at kind of plantar fasciitis, some Achilles tendonitis, anything related to do with the ankle on an anterior, posterior, linear standpoint, this is the go-to piece for me to use. So if we jump into a review process here, we'll kind of take a look at what we've established, what we chatted about. My hope was that this kind of creates you can think about a bunch of your different patients, how you can affect range of motion. Again, we've kind of looked at a bunch of different patient populations in terms of your healthy person who you want to just, you've recognized a range of motion issue. In our cases here, both a dorsiflexion or a hip flexion issue. We've looked at how muscle soreness, how a workout affects our range of motion. Certainly from that standpoint, you'll get a lot from your patients saying that as a result of the tape on, they felt better. They felt that they could get into their ranges better. They didn't fall when they had to sit on the toilet. They were actually able to lower themselves onto the toilet. And so that's kind of a good representation as to what the tape can do for you, as well as kind of post-surgery when fluid, swelling, inflammation is what's clogging up the area, and as well with our arthritic patients where we have kind of a little bit of everything here, where we have a neurological and a fluid base impairment for range of motion. All these things can be improved with using kinesiology tape. And with our webinar goals, as we stated, we wanted to learn how SpiderTech can be used to help our range of motion, and then also how we can apply our ankle ProCut in a way to help our range of motion and help our dorsiflexion. So let's jump into our question and answer period now. I'm going to flip over to that screen. So get your questions in the chat now, and we'll start answering them. All right, good. So the first question is, do you have a YouTube channel? Will you post this webinar later? And the answer is yes. One we're right on top of that. Yeah, we post all of our webinars on our website and through our YouTube channel. And then they all can be accessed at any point. They can be sent to anyone you think that can benefit from this information, and so it'll be there for eternity to help and to learn from. Good. Okay. So next question is do you tape differently to control range of motion versus promote range of motion? I mentioned that at the beginning of the webinar. I think it is a mindset type of thing to start with. Certainly, we're going to put tape on the area that we think has a deficit, and so if we're attempting to create a range of motion, we're going to tape the area that's tight. We're going to tape the area that's sore. We're going to tape the area that's injured, and we explained how that can be done. If we're trying to control range of motion because we're fearful that range of motion is too big, uncontrolled, and we feel this might cause an injury, I think the one thing that comes to mind with that would be a low back, where if your hip rotation was stiff, your thoracic spine rotation was stiff, your kind of shoulder rotation was stiff. The low back is a common area to get beat up, a common area to have to rotate more than it should, and now all of a sudden we are going to end up with an injury in that area. Certainly golf and tennis, you see those patterns tons where any stiffness above and below the low back will cause an injury in the low back of extra motion versus not enough motion. Okay, so if that's the case, what I'm going to do there is I'm going to go back and watch our webinar on proprioception, and in that webinar we saw that when we tape for proprioception, we're going to get tape over top of the spot that we're trying to control the motion of. So the low back, for instance, I would use our low back ProCut, Spirotech wise in terms of the product, and then I would get it on that area of the body. Initially, in a manner that didn't restrict range of motion, my initial thought would be, okay, let's get tape on here and just highlight the low back so your brain can control the motion better and leave it up to the brain to be able to make the corrections and not express too much range. And so I would do it with the person in a flex position, so that way that we're not going to provide any limitation to low back flexion. We're not going to restrict any range of motion. We're just going to highlight by providing a constant rub on the skin that area of the body, so that the patient's brain can make more accurate and more intelligent decisions on the low back motion that we're going to improve upon, or the low back motion we're trying to kind of control. Also, that does kind of take me into a little bit of a structural standpoint, which we didn't mention in the first part of the webinar. Was we talked about how we can promote range of motion, but an example would be if someone had a stiff mid-back, a stiff thoracic spine, that took them into more of a flex position, like a C posture position, that commonly can be expressed as decreased shoulder rotation and decreased shoulder flexion, really actually in kind of full range of motion. You can make an argument for that being able to can be expressed in that way. Where that's the case, I would think about trying to promote more of an extended position in a structural way, where I'm trying to almost kind of limit mid-back flexion in order to promote mid-back extension and then allow the person to express the normal shoulder range of motion that comes with a more extended position. As well as a more extended mid-back has also been shown to promote rib and torso pliability, so range of motion and function. So again, by taking someone into a more optimal posture, if they are stuck in a posture that is affecting things around it, that all of a sudden we can now express our normal function downstream around that area of the body. If you're doing that during athletic competition, I would say let's limit the amount of structural restriction and let's go more towards a reminder, just so within the athletic competition you can express still full range of motion, but you use your judgment on that one as to how much flexion they need, and then how much improvement we're looking for in terms of shoulder or rib or low back improvement. And is there any more questions, guys, before we call this a day? All right. Well, I hope that was informative. I hope that enabled you to envision some of your patients that can be helped with tape, to kind of wrap your head around how tape can be used to help with range of motion. I think this is a topic that really does encompass a ton of your clients and patients, and that it can help with your level of therapy and the results that you give. This was another fun webinar to give. I look forward to number 9 in a month's time. And again, if you want to go back and watch or send to someone who can be helped from the webinar, you can access this full webinar from the website, where we have a ton more education information as well for you to learn about how SpiderTech can help your practice. So without further ado, thank you everyone. I look forward to next month on webinar number 9.